of my work in spine for the last 40 years. I'm not sure if some of your fathers were born at that time when I joined spine surgery. This is my 51st year for inviting me here. We have a problem, Dr. Kavita, as doctors. We have a huge population, and as we start our practice and start our work, the patient load is so much that there is no time to think. This is true of surgeons all over the world. And unfortunately, or very fortunately, the whole medicine is dependent on technology. Gone are the days when you look at the pulse or feel the pulse and say, this guy has this disease. Today, with most modern technology, we still can't identify the problem. So most of the biomedical engineers, in my experience abroad for decades, is that they meet with low quality doctors. What I mean by low quality doctors is doctors who are not interested in research, nor have an aptitude towards research, nor they have an understanding of research, because the big doctors are too busy. That is why the products that you get most times into medicine are too slow in the research area, and it takes a hell of a long time. So there's a fault in us that we as senior surgeons and doctors should interact more with youngsters like you, inculcate the interest, and especially to our country, which is no more a poor country. We are very well off, our governments are rich. So health is primarily, being a doctor, my focus, and if I can instill some interest in one small aspect of medicine, then my job is done. I'll ask this young man a question before you guys ask me a question. Where do you think the world is going? Where are just name 1, 2, 3 areas which you think is the future for jobs, for technology, everything? AI. Doubt it. Yeah. Yeah. The third part is right. The world will always focus on 3 things. First is food. The research into food will never ever stop, because human beings need food. That is a fundamental area. If you look at the net and all the big science programs, food is fundamental. So any research into food is always going forwards and forwards. And next is health. Once you have food, you have health issues, because you live longer, which we are all living. And then next is health. And third is space. Why space? Curiosity. You're absolutely right. If you go to Smithsonian Museum in Washington, you'll find that poster. So these 3 faculties, food, agriculture, health, and space, all these would involve AI. It's just a basic thing. Now, what do you think is the health problem to human beings today? Just offhand. What is the commonest health condition affecting us? Hypertension, right, madam? Obesity is becoming a pandemic, true, which is a pandemic now. Yeah, anybody else? Sir, yourself? Diabetes. Okay. The commonest medical condition that affects human beings, the physical medical condition, is cold, common cold. It certainly is not diabetes. Diabetes, India is the capital, but it is still low on our list. The second commonest condition that affects, how does it go forward here, is low back pain. It's not diabetes, it is not cancer, it is not heart disease, it's not obesity. It is low back pain that affects the human being. And this affects from puberty on to almost till the end of human life. And this is the commonest condition apart from road traffic accident that disables a human being. The commonest killer today is not cancer, it's a road traffic accident in the Western world, and we are shortly reaching those statistics. So it's always that problem. So that is why it is very important, low back pain. And why is it so important? Because it affects the youngsters at the prime of the youth and the young adult age, when the guy is or the lady is working so hard to achieve both in her family life or his family life and work life. So as I said, this is only second to common cold. Unfortunately, 90% of the doctors worldwide do not know that this is the problem. They also, when we ask them in the hospitals, they also say the same thing: diabetes, blood pressure, etc. In 2006, we have a world spine statistics, $1 billion in US. Now you can imagine what happens now. And today it is 87.6% of women and about 82.4% of men who suffer from this problem. So it's a biggest pandemic that you have, and that is increasing, this incidence, and mostly affects the 30 to 50 age group. Now you see that is 8 in 10. And these are the backaches and neck pains that would force you to visit a doctor or will create work absenteeism. That means you can't work properly because of that. And you can imagine $635 billion. And that is why we have a G20, what we call Spine 20. I am a member of that. So every year, till last year, from this year I am not, last 5 years, the G20 nations, in their meeting we go, and from our G20 nations we have a Spine 20 core group which advises these G20 heads on spine health for the world, and this work is published, and we have 3 representatives from India on that Spine 20 setup. So the Italian Prime Minister, when he was the head of G20, he realized the importance of this problem. So that is the amount of money that's going into this back problem. Now if you see here, 80% of the problems, that means if you look at back pain, that's occupying almost 2/3 of the issues that are being faced by human beings. So in 2020, you see here the statistics, 60% increase from 1990, and this is increasing. Else, if you and you belong to that, because today every profession is sitting in front of a computer. If you take that, again you see majority of the problems are in the neck and lower back. Of course you have problems in elbows, shoulders, wrist, etc., but a lot of it is taken up by the spine. Now 90% of these patients who come to us have mechanical back pain issues. That means there is no disease. So 90% of patients coming to the doctors with no disease, there is nothing we can do. That means you suffer, as simple as that. You waste your money on scans, x-rays and tests, and then all you get is a painkiller. That's all you get. There are other causes like slip discs, you must have heard about it. And again, 90% of these slip discs do not require any doctor consultations. Degenerative conditions, my spine cannot be as young as your spine, so I'll have more issues because of wear and tear. Just like even a Rolls Royce at 20 will be different at the age of 60 when it turns 60. So there is trauma. We have a huge incidence of trauma from accidents I just mentioned. So I think Hyderabad takes about 2 deaths a day. I think it's about 500 to 600 deaths in and around Hyderabad a year. I'm not sure of my statistics, but if that is true, for every death there are 11 permanently maimed and 40 minor accidents. That's what's happening in and around our city. So you can imagine why our hospitals are like Nampally railway stations, just with that trauma. And all the highly educated guys in the finance sector, in the IT sector, not one person wears a helmet and not one Hyderabadi drives properly on the road. So we're also responsible for that. I'm a Hyderabadi, so I can say whatever I want to say about this place. Infections. We are Indians, we love to spit. We spit everywhere, and I'm not talking about the poor people, I'm talking about highly educated people like you and me. We spit everywhere, and infectious diseases, TB, which is non-existing in most Western world, is rampant, and we operate like hell. These so many number of spine TBs every year. So that's a problem. And then we cough on the face. Tumors, cancers, these are all there. Metabolic disorders. Now you mentioned about obesity for various reasons, from PCODs in women, put hormonal imbalances to rheumatoid diseases. So many diseases can cause back issues. And of course, a lot of rheumatological conditions like ankylosing spondylitis, rheumatoid arthritis, we see plenty of these. So all this constitutes only 10% of the problems with back pain. So we'll go back to the mechanical back pain that you guys suffer. There is this man, Alf Nakemsen. He is one of the famous Swedish spine surgeons. He is no more. He is the first one in the world. He put transducers. He found out in Sweden a lot of youngsters were getting backaches and they were all sitting. So in the 80s, he got a doubt, why are these guys sitting getting more back pain? He put transducers, pressure in the discs, pressure transducers, and then he measured the disc pressures both in sitting and standing, and when they press the clutch in the car. So he found that the disc pressures are so high in sitting and in traffic and pressing the clutch, and so low when you stand. So that is the reason why a lot of people get these aches and pains, because of constant sitting. And this back pain, he thinks, originates in the brain. It's a brain issue because people get so upset with this back pain and it gets exaggerated. If the servant maid doesn't turn up, the mothers get back pains. If the daughter-in-law misbehaves, the mothers get back pain. If the son doesn't show love and affection, the mother gets back pain. And of course, so many reasons. If the boss shouts for non-performance, they come straight to us. And believe me, we see a hell of a lot of young men who have erectile dysfunction coming to us with back pain. So there is so much mental issue with this back pain. So it's always the brain that controls the body, and that's where it comes. So when you come to us, don't come to us for medicines, because all we give is painkillers. Then they try this method with this back pain, sleeping on the floor, because the grandma says, so if you see an animal in the forest, it collects leaves and sleeps on that. So sleep comfortably, don't waste your time sleeping on the floor, it only increases your back pain. Then there are at least, I don't know, she should tell Mrs. Preetisha, Dr. Preetisha, she is a spine specialist, physiotherapist, and there are at least how many, 2000 types of neck pillows that I have seen, and not one spine surgeon ever recommends a pillow. You sleep on whatever pillow is comfortable for you. Bed rest. Indian doctors love to give bed rest to their patients. Sleep for 2 months, we give a certificate. And our patients love it. And the old ladies love it, and the senior executives love it. They only say, I have a whole organization to run. I've seen lots of your bosses. Hardly they do anything other than talking on the cell phone and shouting at the juniors. And they want also bed rest, so that they are not very answerable to shareholder meetings. They can avoid. Spending money on chairs and mattresses, I'll come to that. Homeopathy. Then they say all these MBBS doctors are useless. I went there, I wasted my money. Dr. Raghava Dutt, he talked to me for 2 seconds, took 2,000 rupees from me. I get 1 star on Google. And then they go to homeopathy fellows. This homeopathy guy can treat anything and everything on this earth. And they give these sweet pills, and people love it. And then, the thing starts. The aunt has gone to Ayurvedic massager, they all go, and this is the problem. And then there is another issue here. Every woman, our mother's age, they all think that exercising, working in the kitchen is exercise. It certainly will destroy the health of a woman, both mentally and physically. It is no exercise at all. Don't be into that zone of mind. I call that Indian women's kitchen disease. That means most mothers get into kitchen the minute after marriage, and then they come out of kitchen just 10 minutes before their death. The whole life is gone in that kitchen, looking after the lazy men and then the children and then everybody else. Then we have these wearable fitness devices. This is very funny. So nowadays I see everybody with this Fitbit watch and they say, "Doc, I do 10,000 steps." This 10,000 steps on the watch is very good. It's called a useless exercise. I don't know if some of you have come to KBR Park in Hyderabad. I see these guys taking around every day. I've seen them for the last 15 years. Every year their the weight increases, the paunch increases. All they say is peacocks, but nothing happens in these walks. It's good to walk, it's good to take those 10,000 steps, but hardly does anything to your body. So after all this, all you do is go to Kerala, and you know why you go there. And then you come back, and then you take a scan before you get to Kerala and come back from Kerala to see if there is a change in the MRI machine. Usually these changes are felt more in the brain on MRIs than in the back. Now, I just heard Dr. Vemur is talking about this. Is this you? That is all of us. Today, because of our lifestyles, we are all sitting in front of computers, be it professors like her, students like you, researchers like you, we sit. And I've already told you the 1980s research, what happens. So 8 hours or more sitting in front of the computer, you can never get better, never. That's the truth of life. Now you see here, now this is the position, you see here, upright position, about 40% is the load, and if you bend forward, that's what we do. No human being can sit straight, and it is extremely wrong to tell people to sit straight. It is like telling Indians to tell the truth. It's good on our emblem, but doesn't work. So, from our grandparents to uncles to aunts to teachers, everybody tells us, sit straight, sit straight. It is a human tendency to lean forward. So that is the problem with sitting. So you can certainly lean back, it's a little better, but sitting straight is practically not possible except when you are doing yoga or meditation, perhaps. In real life, it doesn't work. Now you see here, the average student height, with that height, with the legs, feet parallel to the ground, you are at a 100-degree angle. That increases your disc forces by at least 4 to 5 times, the disc pressures, and then the discs degenerate. That's what happens. So this is the correct sitting posture, and that's what you go and read and download and buy all these expensive chairs. Even the one Mr. Trump has in his White House, I don't know how good it is most useless. All chairs are useless because you are not supposed to sit. As I say, we are not human beings. That is wrong English. We are Homo sapiens. We were made to lie down in the caves. We were made to climb trees to save ourselves from all sorts of animals. We were made to run by whoever created us to find our food. We were made to fight with animals and all sorts of things. Our bodies were always made to run without shoes. And today our lifestyle has changed and we buy these expensive chairs. Don't sit, don't sit, don't sit, don't sit, don't sit. So when people come and tell me, should I change my job, I'm getting backache because of sitting in Google Office for so many hours. It's not the job, it's the way you work. We've been telling the IT industry to always stand up. So get up every 20 minutes. That's extremely important. So change the way you work, not your job. Today this young lady sitting in front of me assisted 2 spine surgeries since morning 7 o'clock. Of course, they were small surgeries. Small means couple of hours, 3 hours, 4 hours, anyhow. So we always bend like this and our necks are like that because there is one monitor here, one there, one there. So all surgeons today are in very awkward positions. So that is our profession and so is your profession, but you have to change the way you work. Always buy a standing desk. That's it. Whether you're working from home or at work, get a standing desk and connect that to that big monitor so that you are sitting, standing every 20 minutes. If you have small monitors, when you start your careers, let us say from mid-20s or late 20s, most human beings today work till 65. So almost 30 to 40 years of your life, your neck is craning forwards and your spine is bending forwards. What can doctors do? Nothing. So if you change your job and go to a bank, it's the same thing. So use large desktop monitors, and these monitors should be at eye level at all times, and restrict the use of laptops and tablets. These are not good, but it is highly fashionable in cities like Hyderabad that some of the schools are saying that we are textbook free schools. That shows the height of stupidity of our educationalists. So move frequently at workplace. So don't text the guy who's only 2 minutes away, go walk there, keep moving. These are things that may look simple, but believe me, 80% of these youngsters that I see in front will suffer from these problems, and that will decrease the quality of your life. So importance of physical activity, this is what I am saying. Stillness is death, rest is rust. So you must move, that's very important. Now this is what the physios tell the IT guys. We have a back school at Hyderabad in our hospital where for an hour she teaches every week. Now this is one exercise extremely important. Today, because of our changed lifestyles, none of us can sit like this, and that's a problem. So this will strengthen your core and also improve your balance. So all these you can do for a couple of minutes at your workplace. Now cigarettes. Alcohol, contrary to what doctors tell you, is good for health if you drink in small quantities. If you drink like my fellow citizens 3 bottles a day, that's a different matter. So alcohol is a vasodilator, and that is good for improving the blood circulation. A glass of beer and up to 30 ml of whiskey is the limits that doctors give. But cigarette, even one cigarette by your colleague smoking next to you will destroy your spine. Nicotine decreases the blood supply to the disc, the end plates that supply nutrition to the disc. So cigarette smokers, whether it's in the form of any tobacco, whether it's gum or tobacco, gutka, whatever, it will just destroy your spine. So in Western world today, most women smoke. Smoking amongst young men has come down significantly. So don't smoke, quit that habit. Quit it now, that's very important. Now, lack of physical activity. And everybody says, I have no time. You may like the Prime Minister of India or may not like him, but I have an eyewitness IPS officer who told me that she saw him get up at 5 in the morning when he came to Hyderabad to the National Police Academy and was exercising for 1.5 hours. And the IPS officers could not sit and squat like him, young IPS guys who come after their IPS for coaching in our Netaji Subhash Institute. So if the Prime Minister of India has the time to exercise, to say that I don't have time is just a fashion statement and not truth. And I see youngsters wearing these collars and bags. That is one sure shot way of damaging your spine. No collar is good. Any restriction of movement causes early degeneration of the spine. So don't use them for a long time, that's not good. What about neck pain? This is again common, low back pain and neck pain in young mothers, because in our cultures we have the habit of lifting children for a very long time. So once they come to the age of 2, don't get onto this habit, leave these children alone, let them run, and lifting these heavy children is not a good option. And again, as I said, looking at computers and cell phones. Use a cell phone, because without that we can't survive, but use the speaker phone except when you are talking something private. Always speaker phones, that's extremely important, or your earplugs. So don't be on phone for long, and again awkward sleeping postures. So sleep tight, sleep well, that's extremely important for good health. It is not the number of hours that you sleep. Most modern medicine says 8 hours, but it all depends on the quality of sleep. If you can sleep 5 hours and it's good for you, that's absolutely fine if it is a sound sleep. Stiff shoulders, stiff neck, this is extremely common. Yeah, very important. Now you see here, the forces, about 27 kgs on the neck when you bend forwards. How can your tender discs at your tender age take the brunt of that? It can't. Now this is the problem. Our mothers make sure that the children don't go for sports because they are worried that the child may, this is a story of our Saurav Ganguly, he said it in a TV interview. They think that if the children go and play games, they'll break their bones and they don't want them to go. But they love these children to feed them with jalebis and all that, so that by the age of 20 they become diabetics and then come to Apollo or Yashoda or whichever hospital with heart attacks and take 22 tablets. So certainly this is making the pharma industry rich and doctors even richer. We thrive on this. So what's my advice? Break all your bones but play games and sports. It is better to break your bones than, or your spine, than eating 20 tablets a day and coming to hospitals at age 30 with 3 stents in your heart. So whiplash injuries, please drive carefully. Don't bang into the back of other human being. You are not NASA scientists that Chandrayaan is landing and you have to rush there. So please don't do that. Have respect for others. Not all people are smart like you. Some of people are old people like me who are driving, and we are not as agile as you. So respect other human beings, extremely important. I talked about a pillow. Always use a firm pillow and a firm mattress. Don't go by these advertisements. Not one spine surgeon or orthopedic surgeon recommends mattresses. It is not in our textbooks. We don't do. Don't believe these advertisements, and if we do that, it's against the ethics. In fact, the Indian Orthopaedic Association threatened Godrej company with a lawsuit because they were using our ex-president's name that he certified that chair. We don't. So buy a mattress that's comfortable, and mattress is not the cause of the problem. Stretch your neck. You can keep a hot or cold compress if you get pain. And above all you young girls here, men are very lucky, we don't get pregnant. If you get pregnant, don't eat too much food and don't listen to your mothers and mother-in-laws. There are exercises you must do. If you do this, you won't get back pains. And even in US, antenatal and postnatal exercise programs are extremely low. It's only in the Scandinavian countries and Europe where a pregnant lady's health is taken care by the medical institutions. So after delivery, you need to exercise. During delivery, you need to exercise. Except less than 1% of pregnancies which are precious pregnancies. That's the right way to carry your babies when you get married and when you have these children. All of you suffer from back pains. So by going to physiotherapists and exercising and keeping healthy, you'll be fine. What about heavy school bags? You see this, the amount of brunt on the spine of these children. They're already getting neck pains, and we see this from corporate schools in March and April, just before the exams. Huge number of kids coming to doctors with neck pains and back pains because against the law. The children are not allowed to go out, not allowed to play, and they work with half an hour break. And you know the names of these schools. They have caused they have increased the suicide rate amongst students, and it's a shame that IITians are committing suicides by the day. We are reading that in newspapers. Some of the most intelligent boys and girls. That's because of too much studies. You should not study too much. That's wrong. Youngsters, first you should not get diabetes. If you have a strong family tendency, all you need is make sure your diabetes is under good control. Exposed to morning sunlight, eat good food, don't take tablets. Avoid junk food. I don't say don't eat junk food. We all love to eat junk food. There's nothing wrong with eating a pizza or drinking a Coke, because we have to live our life. As I said just now, sometimes we have to lie. We can't be 100% like the older generations, but don't live on that. And this is a common occurrence. I work 16 hours in my triple IT and I just sit there. Now these are the forces on spine during lifting weights. Be careful. Always keep it close to the body and then lift that weight. That is very important so that you don't hurt your back. Physical activity, as I said, you need to do exercises, walks, sports. All this should be part of your life. Do core strengthening. So the abdominal muscles and back muscles support our spine. So the stronger these muscles, the better our spine will be. That's what you have to do. So once you do all this, if you can, you lie still. I don't do meditation, but I know I've been reading quite a lot about it, and I've also interviewed the Ramchandra mission head for my association, spent some quiet time with him. It's too good if you can relax. It's walking. How much should you walk? Walking is a useless exercise. It is for 90-year-olds with cancers, with TBs and with kidney problems and all that. You must run. Run like hell. And every doctor in India will tell you if you run, you'll spoil your knees, you'll spoil your spine. To hell with that sort of advice. You must run. You are part of the animal kingdom. You must run. Going for walks, you won't even sweat one drop of water. So what is the exercise? Exercise is that what makes you like that. You should be breathless. That is exercise, not Fitbit watch. Swimming is excellent. So is yoga if you're interested. Most girls are interested in yoga, but most men are interested in gym type activities. But gym can be a double-edged sword. The problem with men is some of them want to become like our film heroes with lots of muscles. So all these guys who have all sorts of muscles can't run from here to ISB. Whereas if you see Djokovic with hardly any muscle can run from here to Delhi and come back. So it's a stamina that you should develop. It's not the muscle. Muscle is good. Muscle makes you strength. It's actually the old people who should develop muscle because we lose muscle with age. So yes, go to gym, but be sensible. Be careful with deadlifts. That's one sure shot way of spoiling your back. Always, always listen to your body. The trainer is only to tell you how to lift, whether you're lifting properly or not. He's not the one to tell us how much to do. Girls certainly are more sensible in gym than boys. I'll just take you through some of the surgeries. This is about your backs. Now I have another 10-15 minutes? Okay. This is where we need help from youngsters. I'll just show you. See this surgery. This is what we do day and night in our spine departments. We open up the spine, we put these screws and all that. I'm so sorry, I'm showing some pictures with blood and all that. It may be not fair for some of you, on some of you, but that's okay. Now you see here, today from that sort of incisions, we have come to this sort of technology. Pinhole, you must be reading about endoscopes, cameras and all that. And this technology you see here, previously for a simple disc problem, we used to remove so much of bone. Today, we don't do that. We use this microscope. And microscopes are not new. I was trained in 1990 in microscope. Just like our cell phones, the scopes have improved, and so is the cost. What was 10 lakh microscope today costs 1.8 crores to buy for the operating theatre. So that's the sort of expenses, and this is endoscopic surgery. See the type of light we get when we put a camera, and see the type of light we get. So there's so much bright light that we get, so we can see the microstructures so well. This was myself getting trained in 1991 in Europe. So it's a very old thing. The technology has made us better. See the type of instruments that we use for a disc prolapse today. All small cameras, so that for a slip disc we just take out the disc and see what sort of equipment that has been developed by these engineers. Without you guys, there's no way we could do this progress. This is again, see our operating theatre, see these lights. This is in 2002. I'm using a scope to take out a disc prolapse. See what we do. See that? That's a scope, that's an endoscope, and then you see that's a spinal cord in the front, and you see how we remove that disc all through a tiny hole, so that no muscle is damaged, no bone is damaged, and your bone strength remains the same. Now we use sometimes the tubes. You see here, we put these tubes in the spine, and then we use these image intensifiers. These are X-ray machines that tell us where exactly our instruments are, which level. Same thing we use in the heart. The cardiologist will know exactly where the stent is going. So you can imagine the radiation that we get from these machines day and night. And then we make a small hole, we enlarge that, and you see here, we put these cameras inside, and then you see this is, I can't see from there, see this is a small disc there, this is a neck, cervical spine, and the disc has come out and pressing. This is the spinal cord, and that's pressing on the nerve, and you see we remove, that is the spinal cord. So we have removed the disc, we have removed the bone, and then we put this spacer. See what we do. So the disc that has gone in and pressing on the cervical spinal cord, which can sometimes lead to paralysis, we remove the disc and then we put the spacer, so we jack it up. Just as we jack up a car when there is a flat tire, so that the ideal height is maintained. You see that? That's what we do. Sometimes you see here again, that is the brain, that is the spinal cord, that is the disc, this is the transfer section that's pressing on the cord. Here we have put a artificial disc, so that the movement is preserved. This girl is in US now. This was done some 16, 17 years ago when she was a young girl studying BTech, and she was getting paralyzed, and she is now a mother of 2 children. She keeps coming back and showing. And it's very interesting that one American surgeon saw this and he said that, oh, India has improved. So this girl corrected him and said this was done 15, 17 years ago in India. So the Westerners think that we are still substandard, but we are not. Now you see here, sometimes we see what we are doing, just putting a needle there, and you see what we do, and even without, see that in the neck, without putting all these artificial implants, discs, we can take out, see the microscopes and endoscopes we use. That's what, you see this microscope here, one of the modern machines, and then what we do, we identify that, and then we take out that small disc piece that's pressing on the nerve. So all these microscopes, all these endoscopes, all these cameras, all these lights, and all the artificial intelligence, now we are doing virtual reality has come into spine. All this is because of youngsters like you working day and night so that we do good surgeries. Now here's a guy who broke his spine, and now this is actually a lady, didn't want scars. See, we put those screws, see the incisions we made. That's what we do with technology. Now here is the guy who broke his neck. This is what we call odontoid. This is an extremely dangerous, life-threatening injury, two-wheeler. Now you see that. Previously we used to put screws from head to below, and today what we do, again as I said, it's not today. What is the date here? 2010? 18? 2010, so 14 years ago, that's what we did. You see here, we just passed a wire under image intensifier guidance and then just put a screw. That is technology that drives surgeons. So he has normal movement, he's got a 1 centimeter scar on the neck which is hardly visible, and then all we give is a small plastic brace. That's what we do. Now you see here, this is a girl with a 110-degree bend in the spine, and that we use these rods and screws, and we put these screws and we make the spine straight. That's what we do. How do we do this? How do we prevent dangers, and what is safe spine surgery? I'll just show you. Now this is another case. We fuse that spine in that child. If we fuse the spine in children, their growth of the spine is affected. So what we do today is, in a child like this, he was not able to breathe well because he was so stunted, his lungs were not developing. He was a 6-year-old child. You see what we did? We put these screws and see how we jacked him up. So every 6 months, we take a screwdriver here and we jack it up. So this 80-degree curve becomes 60, 60 to 40, 40 to 20, like that. And once the spine becomes straight, we fuse it. Now if you see here, see that boy and see here. These are called growth rods. Today we don't open these spines. We put a magnet here. And in the outpatients, we apply the magnet and we can increase the height of the child by 1 centimeter. That's what we do. And same thing is applied when children have cancers in their legs. So we put these joint replacements after removing the cancer, and then we have to increase because the child is growing. So you put a magnet in the outpatient and the limb and the metal joint increases in length. Just like a piston. See what we're doing. These are called growth rods or growth modulation techniques in spine. So every question that a spine surgeon has to face, how safe are these? Now you see here, this girl has a kyphosis or a bend in the spine. She is born with this spine that is fused, and she is getting backache at that tender age because that spine is fused. That's a 40-degree curvature. Now you see what we are doing here. This is exactly what I want you guys to see. You see these small patches there and see these wires? This is connected to this monitor. This Dell computer costs 40,000 and the software costs 42 lakhs. And that can be made by all of you or most of you. I have already talked to Dr. Kavita Vemuri about this, maybe in 5 lakhs. Today that is the cost of that we have to buy, 42 lakhs. And that's exactly like our ECG. As we are operating on the spine, it will tell us the height, the amplitude and the frequency, and if there is any decrease in amplitude or increase in the frequency, that we know that there is a damage happening to the spine, and then we do the corrective maneuvers. Now you see here this girl, we put screws, that is the spinal cord. We went right in front of the spinal cord, separated the spinal cord from the bone, and we put drills, and we have machines, we have tools like, we call them oscillating saws. We put these oscillating saws inside. This will cut the bone but does not cut the spinal cord. One cut on the spinal cord, the child is paralyzed for the rest of her life. So these ultrasonic cutters we use so that the spinal cord is saved, and then see how we are lifting the spinal cord and removing the bone. And then you see my instruments. This is the spinal cord area. I'm right in front from both sides, taking away the bone, and I'm compressing the spine, and you see we made her spine straight, all because of this spinal cord monitor. Now you see here, that's a video.
Yeah.
You could see that jerk there. The guy on the spinal cord monitor has given a stimulus, a certain voltage, and then you can see that these are the curves that we see, and once that stimulus is given, see that? There's a signal change. So you take a baseline and then you compare it with this signal and then see if there's any damage to the spinal cord. Now you see here again, just last few slides, you see that This 17-year-old girl was getting paralyzed because of the damage. Again we do the same thing, use these monitors, go in front of the spinal cord, put screws and rods, correct the deformity, remove the pressure on the spinal cord. So when we put these screws, we need navigation systems, the image intensifiers, all that. So we put sensors on the spine and this picks up the signal. And it is telling me where my screw is going, because right in front of the vertebrae is the heart, the kidneys, the blood vessels, all sorts of important structures. And when we are passing, you see here, this is where the aorta comes down. So I can't go beyond that. And this is the spinal cord. If I enter even a millimeter this side, that will damage the spinal cord. So these navigation systems picking up with the sensors here, it's being picked up by that monitor there, the sensor there, and it is showing me on the monitor where my screws are going. So I know that I am accurately placing the sensor, the screw. And you see here, sometimes when we have a old lady with a fracture, we don't have to operate on the open up, we put bone cement that you use, dental surgeons put cement, the same thing. This gives 74 degrees centigrade temperature, and if it leaks behind, end of story, it will just melt the spinal cord. And if the cement leaks in front, just see the centimeter difference, it will chew away the blood vessels, nerves, intestines, kidneys, your heart, everything. So that is that dangerous, but we keep doing this with the help of this technology that we have. You see how we put that cement. Now you see here, we also having engineers who develop screws that expand so that they have a better hold on the bones of these old people, and also what we call hydroxyapatite coating. So the bone integrates very well with this hydroxyapatite coating. So we put those screws in old people because the bones in old people is like cheese and butter, there is no hold. You see this, to prevent blood loss, we have this technology where this suction and the coagulation happens at the same time. And when I was getting trained, the average blood loss on the first surgery I showed was about 2 liters. Today it's hardly 200 to 300 ml. So that is the progress of technology. You will ask about robots. You see here, this is a child, see his spine, he was partially paralyzed, this Somalian kid. This is where we use the robot in spine. So the robot puts the screw, and in spine it is not robotic surgery, it is just robotic assisted surgery. It only helps us to put the screws. Then after that we have to break that spine, and we have to see this curved spine becoming straight like that. All this requires lots of patience, lots of training, lots of guts. Now this is a girl, your colleague, an M.Tech student. She was pregnant and she developed a cancer. And she came to us at 7 months. The tumor has gone right in front of the uterus. There was no way we could do anything because the survival of the baby was dangerous. So we were following up with the scans. The minute she came to 9th month, the gynecologist obstetrician did a cesarean section, delivered the baby. After that, myself, this is a tumor in the sacrum, the tumor surgeons, the vascular surgeons, the general surgeons, it took us 16 hours on this M.Tech girl. We started at 12 in the afternoon, finished at 4 in the morning, and see the bone that we have removed, the cancer. And this is now 4 years down the line, she is back at work. All these gadgets were used during that surgery. Just maybe 10 years or 15 years before, she would have died within 2 to 3 months after her delivery or during delivery. That is modern science for you, and I urge all of you, I can go on and on. I think some of you guys are so bored you're sleeping, I don't blame you. But this is where you must develop a appetite for research, whether it's engineering, pure architecture, medicine, health, agriculture, space, whatever. And India has progressed to a level now, we are good we are good at copying like Japanese were at one stage. It is time we do research and develop our own gadgets for our own people. And with our talent, with our pool of engineers, and so bright that you are, you can help the medical fraternity and help our own families and friends. in developing tools which are 1,000 times cheaper, as good if not better than what we are saying.